Okay, so this is what type of vertebra? Please say cervical.
Cervical.
Very good. Is this a cervical vertebra?
Yes.
Are you sure?
Yes.
Are you just trusting me? Yes. Good. This is a cervical vertebra. How do we know? We look for the bifid spinous process, right? You guys know that already. Okay, now, this is a cervical vertebra. As you remember that there were going to be holes that are on the lateral side. The name of those holes, anybody remember the name of those? Transverse foramen. Good, transverse foramen. So this artery here and this artery right here, these blood vessels, the artery and the vein, are both going to be vertebrals. So this is the vertebral artery, vertebral vein, vertebral artery, vertebral vein. Okay? Vertebral artery, vertebral vein. Okay. So this is the anterior side, this is the posterior side of the spinal cord. Now, if I could have a piece of paper from somebody, doesn't mind me drawing on it. Thank you. Borrow your pen? Yeah. Thanks. Okay. So, whether we're talking about the brain or spinal cord, there's something that surrounds the brain and spinal cord, and they are called meninges. Okay? So, we have 3 layers to the meninges. Okay, I'm going to write meninges here. Okay? The meninges is the connective tissue that surrounds the brain and spinal cord. There are 3 layers to the meninges. We have the pia mater, we have the arachnoid mater, and we have the dura mater. And notice that it spells pad. Now some people say to me, well, it spells DAP also. Yes, it does. Okay, I'm not going to disagree with you on that one. Okay, I don't particularly care which way you remember it, just as long as you remember it. Okay, now this in yellow is going to represent the skull or the vertebra. Okay, so I'm just going to make it easy and label it as skull, but it could be the skull or the vertebra. Okay, so we have pad. So how to remember the meninges?
Pad.
Say it louder. DAP, I know. One person has to be different. So, what's the layers of the meninges?
Pia.
Pad. What is it?
Pad.
Good. What are the layers of meninges?
Pad.
Good. What does it spell? Pad. What does it spell? Pad. Very good. So we have the pia mater. So say pia.
Pia.
Arachnoid.
Arachnoid.
Dura.
Dura.
Pia.
Pia.
Arachnoid.
Arachnoid.
Dura.
Dura.
Good. Which is closest to the brain and spinal cord? Pia, arachnoid, or dura?
Dura.
Which one? Pia. Which one's closer?
Pia.
Pia.
Oh,
Which one's closer? It's okay.
Pia.
Which one's closer?
Pia.
Which one's closer to the brain and spinal cord?
Pia.
Are you sure?
Yes.
Are you positive?
Yes.
You can tell your friends about it?
Yes.
Yes, good. So with pia, arachnoid, and dura, okay? Now, these layers of the meninges, okay, you may have heard of this term meninges before, or at least a reference to it. Meninges, you probably may have heard about meningitis and inflammation of the meninges, okay? So, we have different spaces that are going to make up the pia, the areas around the pia, the arachnoid, and dura. The space that is going to be between the dura and the skull is known as the epidural space. So the epidural space. So the space between the dura and the skull is known as the what?
Epidural space.
Good. And the space between the dura and the arachnoid is known as the subdural space. It's known as the subdural space. Okay? So you may have heard the term about the term subdural hematoma. Okay? That's what the area that they're referring to. Okay? And epidural, you've probably heard of the term in epidural during childbirth. Next, we have the subarachnoid space. And the subarachnoid space contains your CSF. So it contains the CSF. And remember, CSF is the cerebral spinal fluid. That's the fluid that provides the nutrition for the brain and spinal cord, provides for cushion, and a few other things that we've talked about in lecture. Okay? And the pia is going to lie very close to the brain and spinal cord. Now, I've exaggerated in terms of the spaces. It is not this wide of a space, okay? They're going to be pretty close on top of each other, pretty solid. It's almost like, the way I like to think of it is, you know when you buy skinless chicken, and there's always that little thin film of chicken of that, like, whatever it is on top of it, well, really, connective tissue that's on top of the chicken. Sorry to disappoint you guys. To peel that off, when you peel that off, that's kind of like those spaces. Does everybody understand that? They're often referred to as potential spaces, okay? So that's the brain and spinal cord and the different spaces. So how does this translate to the model, okay? So the layer that is, thank you, the layer that is closest to the spinal cord is called the what?
Pia.
Pia, okay? The next layer out, which you see here, and I have to put a sticker on the inside right here, okay? So this right here, see where my stick is? Okay, that right there, that's the arachnoid matter, and this out here is gonna be the what? Dura, okay? So I could do it from the other side. I could say Pia, and then on, let me check it myself, and then right here is the arachnoid matter, and this area right here is called the what? Dura, okay? So if I asked you, what is this space out here? The answer would be epidural space. So please make sure you pay attention to the way I word the questions. If I'm asking for the tissue or asking for the space, can really change the answer to the question. So this is the epidural space. What is this space right here there for? Subdural space, good. It's the subdural space. So this is the epidural space, this is the subdural space, and then the space here, here, and here is what space? Subarachnoid space. Okay, so we have the subarachnoid space. And what's located in the subarachnoid space? Cerebrospinal fluid. So what is located in the subarachnoid space?
Cerebrospinal fluid.
What's located in the subarachnoid space?
Cerebrospinal
Good.
fluid.
Okay, has everybody got that?
Yeah.
Are you sure? So what layer is this?
That's the Pia.
Very good. Everybody?
Pia.
What's it called?
Pia.
What's it called?
Pia.
What about now?
Pia.
Good. What about now?
Oh, that's the
Arachnoid. What is it?
arachnoid.
What's it?
Arachnoid.
What about here? Okay, so what's this? Pia, arachnoid,
Dura.
dura. Very good.